Hey folks, Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas. I gotta say, it's been some time since we visited this age-old grudge match, but I thought maybe it was time to refresh and revisit. What's the latest thinking and latest information from the experts on the best thing to use? Is it ice or is it heat? The first thing that I would share with you is the fact that I cannot begin to count how many times I've been asked the question over my 20+ years here in healthcare. Should I put ice on it when I get home, or should I put heat on it? Well, PainScience.com says ice is for injuries and heat is for muscles, chronic pain, and stress. If that's not easy enough, let's get a little deeper. In the words of the worldwide back pain expert, Dr. Stuart McGill, it depends on which one you want to use. It always depends. Ice versus heat depends on a few factors. How new or how old is the injury or the pain? How severe is the pain? Is there bruising or inflammation? And are there any underlying issues? So let's start with the first one. How new or how old is the injury or the pain? Well, there's one really simple rule of thumb. If it's brand new, ice probably makes more sense. If it's more than 3 to 6 hours old, heat probably makes more sense in most cases. Now let's spend just a few minutes picking that apart, okay? Ice closes the vasculature. It slows down everything in the area. When vasculature is constricted, it makes sense that inflammation and bruising is lessened. Now on the opposite end of the spectrum, when you heat an area, the vasculature is dilated and opened up. And when you expand the vasculature with heat, you're going to increase the blood flow as well. And not only that, but think about the grade school science experiment where you heat a balloon up. You don't put any extra air into it. You just heat the balloon up and it grows and it expands. Right? You didn't put any extra air into it, but you did excite the molecules. Now, if we excite the area of an injury, it isn't very hard to picture an increase in excited tissues, which should reasonably lead to more rapid healing. Now, if we are thinking purely in these terms, it makes sense that after initial injury, treating with ice would do nothing really significant to benefit, and would actually likely slow down the healing process. As you freeze, you cool, and you constrict the vasculature, it's probably going to slow down the healing process. Now, the second one, how severe is the pain? Well, when you put ice on something, it numbs it. It's a natural numbing agent. In keeping with that thinking, it makes sense that a fresh, very painful injury can be calmed a bit by numbing the area with ice. Me personally, I remember when I was a kid, I had a tooth go bad on me, and I couldn't get to the dentist for a couple of days for whatever reason. Tylenol and ibuprofen, they did not touch the pain whatsoever, but an ice pack to the jaw, it got me through the night and the day until I could get to the dentist. I would say ice could be used the same way for injuries or pain anywhere else. If pain is really getting your attention, an ice pack can buy you a little bit of time and a little bit of comfort until you can get to where you need to be going to get it treated. And we see athletes also using cryotherapy and even cryo chambers after strenuous activities, games or practices, so that they can avoid muscle damage and hopefully decrease the onset of muscle soreness as a result of the activity they just underwent. So let's look at number 3, the third category here. Is there bruising or significant inflammation? The main purposes of treating something with ice would be to decrease pain, decrease swelling or inflammation, and decrease bruising. So for me personally, I'm not concerned with bruising unless the bruise is on my face, right? Otherwise, bruises are badges of courage, proof of battle. Bruising and inflammation commonly occur in the very first stages of a fresh injury. As mentioned before, after the first 3 to 6 hours or so, it's really hard to imagine bruising or inflammation continuing to be an ongoing problem or worsening at that point. So pretty much heat is probably the most effective modality beyond the 3 to 6 hour range after onset of an injury. Are there any underlying issues? This is number 4. Any underlying issues? For heat, according to healthline.com, you shouldn't use heat if you have one of the following pre-existing conditions: diabetes, dermatitis, vascular diseases, deep vein thrombosis, multiple sclerosis. And you would also avoid heat for these following issues: the skin is hot or red. You don't want to put heat on that. The person has dermatitis, as mentioned, or an open wound. If the area is numb and a person can't really feel tissue damage, obviously you don't want to put heat or ice on that. If the person is insensitive to heat because of an underlying issue like diabetes. And so let's talk about cold therapy no-nos real quick. You shouldn't use cold therapy or icing if you have a sensory disorder that prevents you from feeling certain sensations like we just mentioned. The most common of these, again, being diabetes. You should also avoid icing real stiff muscles or joints. Or if you already have poor circulation, imagine constricting the vasculature in a patient that already has poor circulation. That probably wouldn't be a good idea. You also shouldn't use ice just prior to an activity. Now, this makes sense. You would want your muscles and joints to be relatively warmed up and ready for action before any significant use. Now, medical news today says that heat should not be used on a new injury, an open wound, or if the person is already overheated, and ice should not be used if the person is already cold, and applying ice to tense or stiff muscles in the back or neck really might actually make it worse. At the end of the day, it's important to understand that neither ice nor heat is particularly potent or could be considered as strong medicine. We mostly use these two modalities because they are extremely inexpensive. They can be mildly effective when used correctly, and they're mostly safe. And they can even be used as a bit of a placebo. Now, placebo has a bad name. It's got a bad reputation. If we can use these modalities, however, even to a mild effect, and we get some benefit in the placebo area, well, why on earth would we not leverage that to the advantage of the patient? So, there's some general thoughts on ice versus heat, the age-old grudge match. I hope I helped answer some questions for you. Again, my name is Dr. Jeff Williams with Creekstone Integrated Care here in Amarillo, Texas. If you have any questions for us, or if we can help you, call us at 806-355-3000. Let's set you up a free consultation.